back with another video, and this is going to be a new grad nurse vlog. I got this sweatshirt for Valentine's Day. It is super cute. Look, it fits me so perfectly. But this is just some tips on being a new grad nurse. I work on an ortho neuro unit. I'm not going to say too much on that, but just know that it is a wonderful unit and I love working there. But this is just, what does a new grad nurse need for her first official job? So basically, I have some things. This is basically my nurse bag right here. And you can see the bag is bigger than me. But, honey, it holds all the stuff that I need in here. Like, it's a lot of stuff that you need for a nurse, and especially when you're a new grad nurse. You just don't know what to expect when you go on the unit. So, let's get into it. So most of the items that I did receive, when I first graduated nursing school, I did make a wish list on Amazon because most of my items I did get from Amazon. So when you graduate, make sure you make a nursing Amazon list because that is very important. You want that support. You don't have no money yet. You just graduated school. You're broke because I don't know what. You have not received your first paycheck yet. So Amazon has some decent items up there and they're not as pricey. So I did get my bog bag from Amazon. I got my bog bag from Amazon. I will be attaching links so y'all can know, like, just click the link so you can get right to it. But basically this bog bag, this is a size large or extra large. I will post a little picture so y'all can see what I'm talking about. But this is wonderful. They do have a medium size, and I'm glad that I didn't get a medium size because it wouldn't carry all the items that I do have in here. So basically, I have a stethoscope. You need this. It's very important that you have one of these on your first day of work. On my unit, I have to do neuro assessments every 4 hours. So basically, I have to check their pupils. I have to check and make sure they don't have any stroke symptoms, making sure they're not having any numbness in their face, making sure that they can smile. Like, you see there's no weakness in my face. You want to make sure that face is even. If they did have a past stroke history, they will probably have, some slight sloping on that weakness side. But if that's at baseline, then you have nothing to worry about. We just don't want any changes while they're in the care at the hospital. So I do have this stethoscope, and it is Lipman quality. Look, and I have a stethoscope on my sweatshirt. But yeah, so basically, definitely make sure you have a good stethoscope. This off Amazon. This is my badge. And when I first got on the unit, they gave me this. It's really cute. And I love pink, so I really enjoyed that. This I got off Amazon as well. I will attach the link here. Make sure you have this because, and I love the color coordinate, because when you get report from your nurse, when you get on the unit, the first thing you're going to do is you're going to clock in, and then you're going to put your stuff down. You're going to find you a little section where you want to work, like a computer. People be writing their names, like the date and the time on their computers if they want to have that section for their whole shift. But basically the color coordinated pens, you can just unhook it off like this, boop, and then you'll just write on your clipboard. I got this clipboard. It's nothing to it. I just got this clipboard from Walmart. I love this one because it says trust in the Lord with all your heart. And I definitely trust in the Lord because I trusted him to pass the NCLEX. I passed the NCLEX the first time. I did use Archer. I did make notes on the questions that I got wrong, and I just studied that. I did that for about a month, and then I passed by the grace of God. But I do have a clipboard. You want to make sure you have that. I also have notes in here. So this is just if I discharge a patient to an outside facility. So if they're going to a nursing home or a skilled facility. I have notes on heparin drips. I have notes on if a patient has a lumbar drain, anything like that. Also, I have notes on if, like, I need a PCA pump or if I need anything like that. Make sure you have something where you can write your notes down and numbers that are very important. Like, you want to make sure that you have VAS. We call them VAS. They put in IVs for us. So if a patient accidentally takes out an IV, you want to make sure you have that number on in your clipboard. So this is just a pen. I got totally sidetracked. But basically, this pen is very important to me. Very important, okay? I would not want to lose this pen. Because when I'm getting my report, the nurse will say, hey, this is blah, 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 blah. They're 17 years old, da, 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 why they're here, blah, 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 blah. You want to make sure that you're writing down all this information. So the only time I really use the different colors is if I have back-to-back days. Sometimes I do 3 shifts back-to-back, and you'll have the same patients. My unit does that. So if you come Monday, Tuesday, Wednesday, you'll have those same patients all those 3 days. So basically the first day I'll write with a blue pen. Second day, you'll do updates. Is there any updates on this patient? What's different? You know, if their hemoglobin level went down, I will use a different color for my second day with that patient so I can have second day updates. Third day, it can be black. Any updates on this patient? Oh, the hemoglobin level went back up. Oh, they got a unit of blood yesterday or during night shift. You want to make sure that you're having all this color coordination. Different nurses do different things. Sometimes they say, oh, last bowel movement will be green. Oh, if they're on oxygen, this will be red. Like, you know, you'll have your own little thing that you want to do. But just make sure you have different colored pens, because I feel like it just helps out a lot. Another thing that I have is, this is also from Amazon. I put this on my list. This is a lifesaver. I cannot stress this enough. Please get one of these. I know it's kind of geeky. I know it's kind of ugly, but just get your favorite color. Whatever your favorite color is. As you can see, pink is my favorite color because everything is pink, literally. But this is a lifesaver. So basically it's a little pouch. I have this, literally, I just restock it every time I go to work. So it has some things from work, but basically I have this. These are some needles. They are blunt fill needles, okay? 18 gauge, 1.5 inches. And basically, I do not put this in any patient's skin. I'm not giving iron shots with this. This is literally just to get some medicine out. So say they have Zofran or something. Oh, I'm having some nausea, I'm vomiting. I'll get them some Zofran. I will use this needle, and I will also get a 3 ml syringe needle. Let's see if I have that in here. I have insulin needles in here. But anyways, I will get a 3 ml syringe needle, and then I'll just use that. Ooh, look at God. I will get this 3 ml syringe needle. Let me just demonstrate for you guys. So basically, take this out. I only need one of these. You pop it out, put it together like that, and boom. See, you see how big this needle is? You do not want to put this in a patient. This is literally just to get some medicine out of a vial, stick it in. You'll pull 2 mLs out, push out the air bubbles, or 1 ml, however the dosage is for your specific unit. And then you'll take this off like this, and you'll put it to their IV. You'll definitely clean it with alcohol. You'll flush it first, and then you'll hook the medicine up to the IV, and you'll put it in there. And you have to push Zofran over 2 minutes. But basically, I have that in my bag. I also have medicine cups in here because sometimes patients will not have any med cups. And who wants to sit there and go in a patient's room, especially if they're on contact precautions? You don't want to go in the patient's room and then you have to like dig, oh, I don't have a med cup, like, and then you have to go back out, take off your gown, put your gown back on. That's just so extra. So just make sure you have all your items that you need before you go in the patient's room. So I definitely have med cups in there as well. This is a heparin shot needle. There's really nothing to it. If they get heparin, there's some heparin doses like Novanox at our unit. We have them already like pre-syringed, like insulin, you know, like Humalog. If you have any diabetic parents, any diabetic family in your family, you know, they already have like a little syringe that's already together and stuff. But this is basically if we have to get it out of vial. So you'll just take this out, put it together, nothing too serious. But I have those in my bag as well, just in case my patients needed heparin shot or anything like that. This is an insulin needle. These are for my diabetic patients. Most of my patients, their coverage are pretty well. Under 200, we do not give insulin, but it's basically based off your orders. When you look at the Mars, so far, I think all the orders are kind of the same between each doctor, but I'm still a new grad and I'm still learning. But basically, I always look at the MAR, check and see what the actual scale is, because anything less than 200, sometimes they don't need any coverage. If it's over 250 to 300, you might have to give one unit, anything like that. You want to make sure that you're looking at your MAR and you're checking and you're doing all the 6 rights that you learned in nursing school. So this is just an insulin needle that I be having in there as well. What else do I have in here? See, this is a flood. So basically, what I was saying before, when you give an IV, Lord Jesus, I can't even think. When I give an IV push medication, you always want to flush first. You want to clean it and you want to flush it. So this is just a flush, nothing to it. Make sure there's always air at the top of this, so make sure you're pushing that air out because you don't want to put air in somebody's line. I also have sticky notes. I have sticky notes in here because sometimes, like if a patient calls, I do not have the greatest memory. So a patient may call and say, oh, room 26 needs some pain meds. So I'll just have a sticky note and I'll put it on the top of my clipboard and I'll say 26 pain meds. Or I'll say room 27 needs to go to the bathroom. And once I completed that, I will mark it out because I don't want to leave my patients feeling like I'm abandoning them. I make sure that I do my rounds. I make sure that I'm fulfilling every need that my patient needs because I'm called to do this and I just want to be the best nurse that I can be. So you don't want to forget because life could get very hectic. Work could get very hectic. My floor is very, very busy. So it's easy to forget something because you're so busy trying to pass meds. You're so busy trying to give baths. You're so busy doing all these other things. You're even just busy just trying to get a lunch break, literally. But it's very important that you have these sticky notes so you can just remind yourself and then just mark it out once you have completed it so you know that you've done everything that you need to do. Also, I have highlighters. I love highlighters. I have this highlighter because especially when I'll get report from the night nurse. I work day shift as a new grad, thank God. But basically, I'll get report from the night nurse, and then once I get report on all my patients, I'll check on all my patients. I'll update the board, say, hello, my name's Elizabeth. I'm your nurse for today. Do you need anything right now? What would you rate your pain right now, 0 to 10? You know, you want to make sure that pain is controlled. You don't want them saying, oh, I have a 10 out of 10, you know? So make sure that you're staying on top of the pain because that is another sign of vitals. I think that's what I learned in nursing school. But basically, the highlighter is for once I get all my report and I check on all my patients, I will go to the computer and I will look at my orders. Always have to look at your orders. You have to look at your orders, and I'm going to repeat this again. You have to look at your orders. Yes, the nurse may give you a great report, but they can say, oh, patient's not on tele. Then I look at the orders and the patient is supposed to be on tele. So make sure that you're looking at those orders. I highlight important information. Something that stands out to me like, oh, the patient is ACHS. I need to make sure that that's highlighted because I want to make sure DNA, my partner in crime, is checking those ACHS 3 times a day before breakfast, lunch, and dinner. So I just make sure that I highlight something like that. Also, I highlight if they're on continuous capnography. That's to see how much CO2 is coming out when they breathe out. I want to highlight that because I want to make sure that my patient is on capnography. Also, I highlight if they're on tele. I highlight if they have drains because if they have 2 hemovac drains, I can post a picture on here so y'all can see. Maybe I can get it off Google so y'all can see what a hemovac drain is. You might have learned this in nursing school, but basically it's like looks like a circle and it just squeezes together. But basically it will pull out blood out of their body if they just had surgery. I highlight drains because you want to make sure that you're draining those out 8, 12, and 4, okay? So just making sure that you're doing it 4 hours apart. I sometimes don't do it till 9, 1, and 5 because I do my assessments every 4 hours. So 9, 1, and 5, I'm already in the patient's room. So I do something like that, but you want to make sure that you're draining those out. So that's also very important. I have, eraser markers. That's when I go in the patient's room. I'm writing my name on the board. I'm putting the correct date up there. I'm putting their room number, and I'm also putting my actual phone number so they can get in direct contact with me if the patient needs to. They can also use their call bell. You also want to make sure that your patient, when you go in your patient's room, make sure that they always have their call bell. This is like one-on-one, first day you learn on nursing. You want to make sure they have the call bell because the call bell will have pain, bathroom, they have certain buttons up there that you want to make sure that they're able to push because you do not want your patient trying to get out of bed by themselves because no one came to take them to the bathroom. That is a falls risk, and you do not want that on you're a new nurse. You don't want any falls on your record. I also have some extra pens. If my patient needs a pen, say they're doing discharge paperwork, they have to sign a paper saying they understand the education that they received during discharge and putting the date and the time. So sometimes I just give them this pen if they don't have one themselves. Also, speaking about discharge, I also have these in here. There are gauze sponges, nothing too crazy. It's just when a patient gets discharged, you have to take their IV out, you have to take their Foley out or their Prima-Fit, anything that they have that they don't need, it doesn't need to be there anymore. So I just always have these gauzes in here. And I also have tape. I also have tape right here. You want to make sure you have some tape because one, if the IV is coming out or it's just not attached anymore, because you know when you do your assessment you say, oh, IV is clean, dry, and intact. You want to make sure if it's not intact that you have some tape to put that IV back where it is, like to tape that IV back down. Also, I learned when you're taping IVs down, you want to make sure that you can still see that insertion site. So don't put tape over that insertion site because you want to see if it's infiltration. You want to see if the vein is red, if it's any irritation, any swelling. If you tape over that IV site, you won't see any of that. So you want to make sure that you're taping around it so you can still see that IV site as well. Back to when you take an IV out, you want to have this gauze, you want to have this tape. So basically what I do, I learned this when I was a CNA because I was also a CNA for like 2.5 years or 3 years before I went to nursing school. So basically I open this out, I set up my area, I put a paper down because I'm just like a germphobe low-key. So basically I have a paper towel down, I'll put my gauze down, I'll go ahead and get a piece of tape, I'll take that off and just cut it off, and then I'll just attach it to the table, and then I'll get an alcohol swab. I also have alcohol swabs right in here in this pouch. On this side, I'll get an alcohol swab and I'll go ahead and I'll use the alcohol to help get that tape off the skin because I don't want to cause any pain to my patient. So once I do that, I'll put this gauze where the IV site is. I'll go ahead and pull out the IV. I'll tell them to press down for a little bit, and then I'll go ahead and get my piece of tape off the table and just tape it on there. And then that's it. So this bag is real handy, okay? I also have, when they have a PICC line or anything like that, you don't use alcohol, you will use these purple ones. And what are they called? Oh, chlorhexidine. I couldn't think of it. But yes, you want to use chlorhexidine if they have like a PICC line or anything that's not just a peripheral line because you want it to be very sterile. I also have some scissors in here because especially when I'm trying to open some type of pill and it's not coming out and I'm getting frustrated, this helps. Also, lidocaine patches, you have to have scissors to open that. Scissors just help with a lot of things. Anything that you need, you want to make sure that you have some scissors. What else do I have in here? Also, when my patient is done with their fluids or anything like that, you want to make sure you have some caps because you don't want, or if something just needs to be, the IV fluids just need to be stopped for a little while. You want to make sure that you have an end cap because when you unhook it from the IV site, you don't want to just open to air. That would cause, it would just cause an infection at the IV site. It's a whole bunch of things. It's germs in the air that we breathe. So making sure you have that cap on there, making sure it's not touching the bed, the sheets, the floor. That cap will keep that area sterile so the patient won't get any infection at the IV site. I also have this cloth right here. I got that from Amazon as well. And that really just helps with IV pushes when you have to push meds over 2 minutes or anything like that. If you're getting Dilaudid or anything, like any type of pain med, you want to make sure that you're checking their blood pressure before. And you also want to make sure that you're pushing that med very slow because you don't want them to get all oozy and stuff. Like, you just don't want that. Ooh. Also, the back of the pouch, a little pouch right here. Sometimes I put my AirPods right here, but I haven't recently. But I also have little bars because sometimes work can get very hectic. You can have up to 5 patients on my unit and it can get very overwhelming a little bit, but it's nothing I can't handle. But sometimes you just need a little bite to eat real quick. Just have some little bars in the back. Also, these shoes. So before, when I first was a new grad, I had Crocs. Yes, Crocs and the cute little things on the top. Oh my goodness, it was so cute. But honey, when I tell you these are just for fun, Crocs are just for fun. When you're working a 12-hour shift, especially when you're doing three 12-hour shifts back to back, Monday, Tuesday, Wednesday, or Tuesday, Wednesday, Thursday, your back, your knees, everything. When you're taking care of a patient, it does take a toll on your body. So make sure that you're doing self-care. So I do schedule monthly massages because I just love that. Okay, and it just makes your body feel good. But as soon as my mom got me these for Christmas, I'm trying to tell you there was a difference. There was a difference. These Hoko, HOKAGAVIOTA 5. These shoes work wonders. If you don't get anything else out of this video, please get these shoes. I'm telling you, I don't like touching the bottom. I gotta wash my hands down. But I'm telling you, you have to get those shoes. I have seen a difference in my back pain. I have seen a difference in my knee pain. Just constantly walking back and forth. Hopefully, sometimes you may have your rooms close together. Like I may have 13, 14, 15, 16. But sometimes rooms can be all over the place, especially if we just have a full house. I mean, it's just the charge nurse will try to do their best, but sometimes it is what it is. You're gonna have to walk. You're a nurse. You're gonna have to walk. You're gonna have to take care of yourself. So the number one way to take care of yourself is having some good, expensive shoes. You have to just get them. It's no ifs, ands, buts about it. You have to get those. I know y'all wondering, like, you got that big bag and all you got is that, but basically I have other snacks in here. I have a Sprite in here. I have this snack. I have cheeses. I have some more flushes. I also have this. Most of the time I'm going downstairs to get me some food for lunch or breakfast or anything. But sometimes when it's so busy and you just need to eat for like 10, 15, 20, 30 minutes real fast, honey, these come in clutch. Go ahead and put those in the microwave. I also have some mints and stuff like that, just in case I want to just freshen up my breath. There's a lot of things in here. And I also just have a folder. This is my folder that I got when I first got hired on a unit, and it's still in here. Also, another thing a tip that I want to add before I end my video is, so I do use plastic bags. They're like little Ziploc bags that I get out of the clean hole. We call it a clean hole, but it's like a little storage unit that has our Foley's, all those equipments and stuff like that. So basically, I get 4 bags because most of the time I have 4 patients, but sometimes I have 5, but most of the time I have 4. So I'll get those Ziploc bags and I'll put my room numbers on there. A Sharpie on here as well. And I'll put the room number. So I'll say 15, that's 1 plastic bag. Room 16, that's a plastic bag. Room 17, that's a plastic bag. And room 18, that's a plastic bag. So just having those plastic bags helped me to not walk so much. So I would go ahead and send all my meds to the Omnicell. The Omnicell is basically where you get all your meds. Like they have every single thing. Miralax, laxative, Cinecos, all that. Like, I don't know why I just named all poop medicines, but that's just the first thing that popped up in my head because it's very important on my unit because we give a lot of pain meds, and pain meds can slow down the digestive tract, and a lot of patients can get, they can get constipated. So we give those out a lot. But basically, when I have the room numbers on the patients, it's just so much easier for me to get the meds. So when I go to the Omnicell, I'm like, okay, room 15, go ahead and put the meds in. I just put the meds in, put it in my pocket. All right, let me go ahead and get room 16, put it in my pocket. You know, like I put it in the bag and then I put it in my pocket. I may even do 3 patients. I might do room 17. Go ahead and get their meds and put it in my pocket. And then I'll just go in the patient's room and just pass the meds. I keep the other patient's medicines in my pocket, but I'll just pull out that one bag that's for this specific patient and I'll give those meds. Then I can go to the next room. It just saves a lot of time. This, you know, before when I first started, I was getting the meds and then I'll go to that patient. Then I'll go back to the Omnicell, get the meds, and then I'll go to the, it's just a lot of walking back and forth, where you can just save a lot of walking just by having that bag together. So I don't know what other tips I can say right now, but I'm definitely going to do more of these nursing vlogs. I really hope this video helped. I don't know what else to talk about, but that's just some tips. That's just some stuff on what you need for your first day as a new grad nurse. I will drop more videos. Just ask me questions in the comments. Also go to my community section on my YouTube channel and let me know what else you want to know about my journey of being a new nurse. I truly enjoy it. It's definitely worth it. Don't stop. Like, we're gonna have stressful moments in nursing school, but it's definitely worth it in the end. I'm definitely at the sunshine part of my career. It's amazing. Ooh, I love learning different things. I love my unit. I have learned so much. My unit is amazing. It's just so fun. Like, I really enjoy it, and I know you guys are going to enjoy it too. Please just keep working hard. Whatever you're doing, just work hard at it, and you're going to get to the finish line. Anyways, Jesus loves you. I hope you enjoyed this. Please subscribe, like, comment, share, do all the things you need to do. Thanks. Bye.